Well, I'd like to welcome right now with me Dr. Andrew Chang. He is with the California Protons Cancer Therapy Center, which is down in La Jolla.
That's correct.
Thank you for coming up here today.
Thank you very much. I'm happy to be here.
It's a pleasure to meet you and to learn about this type of therapy. I know we've learned about it in the past before, basically the same center and some of the great doctors that are still there. You're going to get a little bit more into that, and I think the first thing is, what is it? What is proton therapy, and how does it work for cancer?
I'll be happy to talk about proton therapy. Protons is a form of radiation treatments, and when I think about cancer treatments, we generally think about three main ways of treating cancer.
Okay.
We use surgery to cut out a tumor as much as possible. We use chemotherapy that goes throughout the body to destroy any little small cells there. And we use radiotherapy, kind of focusing an area where a cancer is or was to help clean that area up, sort of mop it up in essence. Proton therapy is a very special form of radiation therapy that allows us to kind of pinpoint the radiation a little bit better than standard radiation, and so allows us to give the treatment with less of a chance of side effects.
Okay, and I think beyond the actual cancer, that's what people fear most, not from the surgery part, of course.
Sure.
But from chemotherapy and radiation therapy, you know, all the different kinds of side effects, the myriad of side effects.
That's correct, yeah.
So how does this, well, I think my next question is, does this work on all cancers, just certain ones that are eligible for this?
Sure, that's a great question as well.
I should also go with that, the size of the cancer. What if it grows? Can you still use this?
That's a great question, or a great set of questions. Certainly proton therapy can be used for any sort of cancer that radiation treats. And so in general, that means any cancer, any solid cancer in the body, we can certainly treat with proton therapy. The most common cancers we've been treating with protons have been brain tumors, as well as cancers in the prostate, which is the most common cancer among men.
Yeah, I've heard of that specifically. Yes.
Exactly. And one of my colleagues will be here later on this year to talk about that, Dr. Rossi. One of the things that we've been doing more recently over the probably past 5 years or so is using proton therapy to treat breast cancer. Okay. Now that's one of the most common cancers of women, of course.
Yeah.
And yeah, it's a great treatment to help protect the normal tissues.
Now with something like breast cancer and prostate cancer, is that, again, once you identify it, it can go in and be very, very precise. So
that's correct.
You're not basically taking out, or with standard radiation therapy, killing off good cells. You're doing it much more precise. And
much more precise in what we're giving it. But you know, one of the ways I kind of describe it to my patients is if one thinks about standard radiation, kind of like a shotgun that hits everything in the area, proton therapy, you could think about like as a target rifle, right? You could pinpoint where we're giving that radiation a bit better. So if you imagine a piece of paper with a circle drawn on it, use a shotgun, you get some bullets inside the circle, some bullets outside. With a target rifle, you can get all the bullets inside that circle. And that's what we try to do.
Great way to say that. Now, this is what's really interesting. It's been around for 60 years?
Yeah, that's right.
That's not the misprint here.
That's not a misprint.
Wow.
Yeah, so proton therapy is actually a evolution of a medical research device. The accelerators that were used for heavy physics research in the 1930s and 40s. And in 1946, one of these early scientists said, hey, you know what, we can use this for cancer treatment as well. And so the first patients were actually treated in 1954 in California, Berkeley, one of our premier University of California research laboratories. And people said, this is great. It wasn't until the 80s that we actually designed one specifically for medicine and not just physics research, but it's been around for a long time.
And why is it then that people haven't heard about this quite as much? And why isn't it used more?
Well, these
or this type of radiation therapy, I should say.
Yeah, it's actually something that is starting to come across public awareness more. You know, when we started doing this in the 1990s in a medical facility, that was the only one in the world. And so very few people had access to it.
Okay.
Even 15 years ago when I started doing this, there was only 3 in the country.
Wow.
Well, in the last 5 years, now there's 28. And the next 5 years, there's going to be another 20 or so that are being developed. And so it's starting to reach the level people are hearing about it. It's a great form of treatment, and it's actually been covered by Medicare completely for over 15 years now.
Wow. So is it maybe the cost?
Sure. The cost
not
and time.
only the cost for insurance costs, whoever might be paying, if it's Medicare, that sort of thing, but the equipment, is that more costly? And I've seen in the past the whole room that's in there that the patient lays down on, and so is that part of it as well, and bringing that cost down?
Definitely, definitely. Okay. Building this equipment is quite sophisticated, and so it's quite expensive. And on top of it, it's probably the most complex device ever made for medical treatments in human history. And so just designing one and building the building and the process of planning it out takes 5 to 10 years just in that process.
Wow. Wow. I would also have to think as well that with the patient coming in, that you know, once you pinpoint where it is, they have to be very still. Yeah. And make sure they don't move, because you're pinpointing something now.
That's exactly right. Yeah. That's exactly right. So we use a lot of different ways of making sure we help the patient to hold still. We make some devices that help remind the patient to hold still. In essence, a bean bag we suck the air out of, so it kind of forms to the body, and other devices such as that.
So how are you folks different down at your center versus, you mentioned there's a few other proton therapy centers.
So the California Protons has the fantastic advantage of being one of the newest proton centers in the world, and as such it utilizes the newest technology in order to deliver that treatment. That, in addition to being able to do precision treatment, allows us to do it quicker as well as to a larger portion of the body. So previously at the centers, one of the things I mentioned is in the last few years we've started treating breast cancer. The previous centers weren't able to treat breast cancer as easily because it was a larger area than the small tumors. Okay. Now with the newer proton centers like at California Protons, we can treat the entire breast if necessary for a patient.
What about the patient themselves as far as they live up here, they go to their primary or specialist, can they say, you know, this is the place that I want to go? How does that, since you know, you're down in San Diego, how does that work out? How do they get their care provider to get you folks on board?
Sure. Well, most cancers treatments require a team of doctors to care for the cancer patient. And generally, if a patient is interested, they could just ask their oncologist, their cancer doctor, and say, can I have my records reviewed by the doctors at California Protons? And the records are sent to us, we review it, and then we tell a patient whether or not they're eligible to come see us. So we're always happy to review. Yesterday, I saw a gentleman from Hawaii that just flew in for his consult.
Oh, wow. Now, along with that, because this is more of a pinpoint therapy, does the patient have to come back every couple of weeks, or how does it take longer or the same amount of time to basically go after the cancer to the point where you can say they're cancer-free, or you know, we're at the point that you no longer need this?
Yeah, well, fortunately, it's very similar to how standard radiation is done. So it's not a longer period of time. And in some cases, because we are more precise and pinpoint, we can do the treatment in a shorter amount of time than standard radiation therapy. Okay, so that's good. Now, you mentioned how the patient can ask their physician to send these down. Is that a request somebody, if they make that request, are their physician or their team obligated to do that? Or are they going to go, no, we're better? Or, yeah, no, most physician teams are very happy to send records. Well, doctors usually want the best care for their patients. And so if patients have questions, we're always happy to say, you know, come give us a call, contact us, and we'll be happy to facilitate that for the patient. Very good. And again, you're down in La Jolla area. That's correct. And nice area, by the way. And it's great to have you here. Well, thank you very much, Ken. A pleasure to meet you. And I know we'll see other doctors. Yep, and I'll be up myself the next couple of weeks as well. All right. We'll get him in one of the photos on the website. He's wearing a Spider-Man one because you deal with pediatrics. I also treat the children, yes. All right. So next time, wear the Spider-Man. There he is. Next time, wear the Spider-Man. I'll be happy to do so. All right. He's got kind of the theme going. I've got the colors going, yeah. Or maybe Incredibles. I don't know, one of the two. But it looks great. I want to give you the website, very easy, CaliforniaProtons.com. 858-549-7400 is the number. Great folks there, and we're happy to have you here. Well, thank you very much. We'll be right back.